Hello and welcome to Fulfillment Therapy. My name is Maddie, Kendra Nilsson's COO, and today we'll be listening to episode 281, Why is Attentive Parenting in the First Year So Critical for Baby's Mental Health? With Dr. Joanna. We hope you enjoy.
Welcome back to Fulfillment Therapy. Today we have a special guest with us, Joanna Parga-Belinkie. She is an associate professor of pediatrics and clinical neonatologist at the Children's Hospital of Philadelphia and the Hospital of University of Pennsylvania. She's a spokesperson for the American Academy of Pediatrics and co-host of their flagship podcast, Pediatrics on Call. She lives in Philadelphia with her husband and 3 children. So thank you so much for coming on the show today, Joanna.
Thank you so much for having me, Kendra.
Yeah. So tell us a little bit about yourself in your own words. Things you love, how you got into this space, any of that.
Yeah, I have always loved babies. I just think they're such incredible little humans and there's so much potential there and so much growth. And I think that did drive me somewhat into pediatrics, though I have to say that no one in my family is doctors. So I was the first doctor in my family, and that was exciting for my dad in particular, who is retired now, but was a judge and a lawyer. And in his mind, when you entered into a profession, you had to choose law or medicine. So maybe I was compelled in that sense to go into medicine. But I was the first in my family to become a doctor. So I didn't really have the role models within my family to understand the profession and how much of a calling it really was. And when I was in my training, and I did my medical training at the Mount Sinai School of Medicine in New York City, and then in Los Angeles, I was at the Children's Hospital of Los Angeles and also the University of California, Los Angeles, UCLA, Ronald Reagan Medical Center for my fellowship training. And it wasn't until medical school when I was in New York that I really got into neonatology, which is specifically taking care of babies, even though I always loved them. And that was in part because I had a mentor who my 2 interests were doing procedure and also kids and babies. And they said, you should become a neonatologist, where you get to combine doing procedures because we do intubate, we do lines, we put in chest tubes. So we do all of this acute care medicine, which is really intense, at times exciting, at times very trying and emotional. And so we do that. And I also work in the newborn nursery. So I also get a chance to take care of healthy babies as well. And then, of course, took care of my own babies. And I feel like a lot of experience with infants. I spend a lot of time with them during the day. And I love talking about them.
That sounds like a really fun job in a lot of ways to hold babies all day and to learn about babies. How can you be grumpy?
And to help them get better. And so sometimes I have people say, wow, that's a really hard job too, because you see a lot of sick babies and you see a lot of parents who give birth and this was not what they expected. Either the timing of the birth or the way they gave birth or the baby needing care in the hospital after birth, right? Many parents this is not what they expected. And that can make it a difficult job. But I always say to that, of course, I've seen babies not do well and even die, which is really, really emotional. But the majority of babies get better. They are able to heal. They are able to thrive even after an unexpected birth experience. And that is just amazing to see. So I have a very resilient patient population, which I think people don't think about a lot for babies, but it's true.
So tell me about this book that you have out right now.
So this book is called The Baby Bonding Book, Connecting with Your Newborn, and it is really about how important it is to make time and space in your busy day in modern parenting to really make an emotional connection with your newborn and to focus on relationship building with them. And the reason for that is that first year of life for any human, the brain grows exponentially. And so parents will often cite the amount of things that your baby does from the newborn period to age 1. It's incredible. And that is a reflection of how much their brain is developing in that time. And so I get a lot of families asking me, how do I bond with baby? When do I start? And I always say it starts on day one. There are a lot of really practical things you could do to start bonding with baby. And that bond that you make with your baby, and this is a part of research called early relational health, but that bond that you make with your baby early on, again, is really the foundation for that exponential brain growth that they're going to have in the first year of life. And that growth is really dependent on safe, stable, nurturing relationships for that baby. And so I really wanted to highlight that it is okay for parents. They have permission to take time out of their busy lives and really focus on the type of relationship they want to have with their baby, because that is going to be the ultimate brain boost for baby's growth and development.
Are you saying for that first year, or especially that first few weeks, months, like what is the best?
Yeah, I think thinking about it and starting it as early as possible, because it really, again, in that first year that the brain is just creating all of these new connections, is wiring itself, and is also setting itself up for how it's going to respond to the environment. And so that can start on day one when baby is born and how you interact with them. And in particular, I get a lot of questions about skin to skin time early on and the importance of skin to skin time. And we talk about for babies who are born healthy and at term, right? So completed, have been born around their due date. That's what at term is for us. This golden hour after delivery, where the baby gets placed on the birth parent and gets that experience of being skin to skin with them. And we know that there's good research to support that that really actually helps for parents that want to breastfeed, right? So having them on the chest, that really influences their milk supply and the ability of their milk supply to come in. I see babies that don't wind up getting that golden hour because they wind up in the neonatal intensive care unit for whatever reason. One common reason might be that they're born early and born premature. And so they need that extra time in the hospital to be supported in their growth and to help them mature. And then we know that skin to skin time in that period is super important for helping the baby to regulate their vital signs, right? So when we're in the NICU, we track the vital signs of babies. And what are those? That's baby's heart rate. So how their heart is beating, how fast or how slow. Their breathing or their respiratory rate. So how often they're breathing and also at what rate they're breathing. And then their oxygen levels. When premature babies get put on the chest of a birth parent, the other parent, or another loving, attentive caregiver, that's what babies really need to grow and thrive, we can see how that helps to stabilize their breathing, stabilize their heart rate, put them in a calm state. And that is a really amazing thing to see. And while we don't have good data on that for term babies that we don't monitor as much, right, we can extrapolate that there is probably some really good bonding that happens with skin to skin time, even for term babies. So this is just one of many ways in which you can bond with baby.
Makes me a little bit sad talking about these things because I have 4 babies. My last 2 were premature and we didn't know. I was put under. I don't even know when I got to see my newborn. It was a while. And the adverse effects of that. Can you recuperate that, or is it just, sorry, your child's going to be struggling?
Well, thank you for sharing that, because I think birth should be this joyous moment. And I think there's every reason to be excited for birth and to be planning for it and to want it to go a certain way, to have expectations about it, right? Because we're humans, so we have expectations about things. But there are going to be times where birth doesn't go the way you planned. And that is really hard. And also, we know that parents are at increased risk for things like postpartum anxiety and depression, right? Because of those changing hormones. And because, in part, the birth experience is hard. Even when it goes well, it can be really hard on that birth parent, on their body, right? And on their ability to identify themselves and their identity after they give birth, when they have a new human in their life that they're taking care of. So it's so important that you shared some of your experiences and that it can be sad after you have a baby. So it's not just that golden hour or skin to skin time in the first few hours or even days of life that is the most important for bonding. It's other things too. And we could talk about some other strategies for bonding as your baby gets a little bit more interactive, and even when they're not and their brain is still growing because they're out. But the most important thing is a loving, attentive caregiver who is going to respond to their infant in whatever way they can. So if your baby winds up in the neonatal intensive care unit, for example, there are many staff there who are responding to babies' needs, who are helping to change their diaper, who are checking in on them, who are laying hands on them, who are participating in their care. And that is all going to be a boost for baby, right? They're not going to be missing out. A lot of NICUs have physical therapists, occupational therapists, and speech therapists who are all there to focus on development and brain growth. So one of the silver linings of being in the hospital is actually getting a lot more hands on baby and a lot of support from staff there. And I always encourage families to make those supports because safe, stable, nurturing relationships are the foundation for a baby to grow and thrive. And even as adults, I feel like they're really important for us too. And raising a baby should never be something that's done in a vacuum. It's something that requires community. And community can be found in all sorts of different ways. So I don't want you to feel like, Kendra, that because the birth experience didn't go as you planned and maybe you didn't get the benefit that we know that can happen in those first few hours with skin to skin or first few days to weeks. That doesn't mean you can't bond with your baby. The babies are so resilient, right? So you have so much more time in that first year to really be there and influence the kind of person they're going to become.
That's good to know. Maybe you can speak to this, but in hospitals, I was under for a while, so I don't know what was happening. But I don't even know if they offered to have my husband hold my baby skin to skin. Is that something that they're like encouraging more or across the board?
Yeah, definitely. And I'm glad we're talking about it too, right? Because I feel like being with baby dependent, and you could speak more to this, your baby's situations after delivery. It sounds like you had to go under general anesthesia. I don't know if babies, did they wind up having to need medical interventions or anything of that nature?
Yeah, he was in the hospital for, I think he was, it's funny, I'm already forgetting, but he was a couple months early. He had to be there for about, I think about a month, if I'm remembering right.
Oh,
And yeah, in NICU. And yeah, just a lot of stuff. It's such a blur being in that, like that dark room forever. Yeah, it was not a beautiful, lovely experience at the time, but glad that's over.
but it was a moment in time. And I think that's actually a good thing for parents to hear, that as much as it can feel difficult to be in that newborn period, wherever you are with it, whether you're in a dark room in the hospital or you're in a dark room at home, it's a fleeting period. It's an important period for establishing a relationship, and it can affect how you establish that relationship, especially if it didn't go as you hoped in the beginning. But it is a fleeting period, and there is time afterward to really make those connections and bonds. It's interesting to hear you reflect back on it. I would really advocate for parents when they have an infant in the hospital to understand what their medical needs are, have those clearly communicated to them, and how active and involved they can be in holding baby, in touching baby, in changing their diapers, in helping with feeds when it's appropriate for the baby to be feeding by mouth, because sometimes some babies, when they're sick, have a delay in that. And, I mentioned some of the other specialists that we have in the NICU, including occupational therapists and the speech therapists and the physical therapists. And parents, I always encourage parents to participate in those therapies as well, because it can be really hard to have a baby in the NICU. You lose a little bit of the agency that you have when you're parenting at home because you're not in control of that environment. So for when you have friends or family who wind up in the NICU again, I think really encouraging them to get as involved and actively involved as they can be is beneficial both for baby, but also for them in establishing their role as parents and also in being actively engaged in care. And that's something I advocate for all my families when they come into the NICU.
Yeah, I love that. When I was doing it, I just didn't think people were asking the questions. There wasn't, especially over where I was giving birth. And that's changing so much more. You can advocate for yourself and have it be more flexible. And I think that's so beautiful. I guess I hadn't really thought about it in a NICU case that you could still do that. So it's good to know that there's, for example, it was really depressing to be in that dark little room with my baby for a month. Is there a reason that has to happen? Do most hospitals have these dark little rooms to nurse babies? Is that important for premature babies? I have no idea. I have no idea why I was in this dark little room. It felt like a closet.
I think, anyone who's listening who's had a NICU experience or is curious about it, there is a lot of variation between hospitals in what NICU rooms might look like. Some may have windows. It sounds like yours didn't. Some may be private rooms. Which was yours, a private room?
Yeah, it was.
Okay. And some may be in units where we call it an open bay, where you have 5 or 6 beds in one unit, which doesn't afford as much privacy, but that might just be how it is structured in that hospital. So you get a variety of hospital environments, and there is ongoing study into what environments are the best to support particularly premature babies, because that is a big population in the NICU. And how premature was your baby? You said 1 month, so 34 weeks
Yes, is it so bad that I don't even remember anymore?
or 36 weeks? It's
Uh,
not bad. It's not bad at all. I think as a neonatologist, I'm just curious.
yeah, I think he was 6 weeks early, but he had been on the verge of coming for like weeks before that. So yeah, they prolonged it and eventually he came 6 weeks early.
So we typically consider term to be about 40 weeks. So 6 weeks early from that. So do you think they were around 34 weeks then?
Yeah, I think so.
Okay. And that's a really interesting period of development for baby. There are some 34 weekers. So 34 weeks is right when the suck reflex develops for a baby. And so I take care of some 34-week babies who have a good suck. They have that coordination to suck and swallow. Now, every 34-week baby gets tired doing it because they just don't have the endurance and the muscle strength to really feed all of the milk that they need to grow and thrive at once. So it is like marathon training for them to learn how to eat. And that typically is what keeps them in the hospital for a longer amount of time. And they start to fall into a group of babies that we call the great pretenders, because they can actually be of a good size and seem to look term, because extremely premature babies have a certain look to them, but not 34 weekers. They typically look very well developed. But their skills are not the skills of a baby. They're just not 100% ready to eat all their feeds to grow. And sometimes they do have trouble controlling their heart rate and their breathing rate. So sometimes they forget to breathe, and that's called apnea. And there's a term for that called apnea prematurity, which is a very specific diagnosis of premature infants forgetting to breathe because their brain is still developing. I can imagine you being in that dark room, because the other thing is that babies born premature in general, we try to reduce external stimuli and more mimic the womb environment for them, which is a darker place with less light and where noise and sounds are buffered because the baby's inside you. And so you've got your skin, your muscle, your uterus blocking sound and noise and light and other things. And babies don't have circadian rhythms yet. So for you, it's depressing to be in a dark room. But for a baby, they don't really know
Right.
about night and day yet. So it's probably less depressing for them. And it is probably more womb-like for them, which is generally considered to be more soothing for premature babies. So a lot of units that take care of premature babies really work toward a low stimulus environment that supports their ability to be in a quiet place to grow. And so I can imagine how you wound up in that room. But it's important that you are mentioning your feelings about that, because it's also at a time when the birth parent is really at risk for postpartum anxiety and depression. And particularly when your baby's in the NICU and that is not the environment that you imagine them to be in, that risk is higher. And so that is why many NICUs, if not all, do screen for postpartum depression and should also hopefully be offering supports now in the form of social work. And we even, where I work, have access to things like psychiatry and other things to really support birth parents through what can be a very difficult time in parenting.
Yeah, especially when there's kids at home, or in my case, I had 3 young kids at home. My husband was in his master's program and working. It was crazy. But I know a lot of parents have different things like they don't anticipate. Lots of different things that can happen. I'm always curious about how much things matter when you're pregnant, the delivery right after. Hopefully you can speak to this. But I've been very curious about So background, my dad went missing for about a week. And during that time, my mom found out she was pregnant and he died. And my mom was grieving right as my little brother was developing. She had 6 kids at home. Anyway, very traumatizing situation. And I have been so interested in how that brother developed and grew throughout his life. And since then, this isn't supposed to be this really terrible story, but it is a sad story. He really struggled in life. And a couple of years ago, he ended up overdosing on heroin and dying. And I've often wondered if that was connected at all to like how he came into the world and that horrible phase through all of that. I know it's not necessarily all connected, but do we know stuff now about grieving mothers or and then coming into the world and just not really being touched a lot or any of that? Can you speak to any of that?
I can speak to the fact that there is a lot of research that I hope will continue to be ongoing because I think what you're bringing up is so important that we need more research and more data on how much pregnancy and the things we do during pregnancy and the things that happen to us affect the growing fetus. And we know some connections there, right? Like when we've studied some medical conditions that say mom has gestational diabetes, for example, we know how that has a direct effect on the baby. Things like grief are much harder to study, right? There is not a biomarker for grief that you could test a pregnant person for and say, okay, this grief marker is, high in this mom. So we're going to be really more worried about the neuroconnectivity of the brain based on this, right? We don't have that good science. That is why I really hope that science in women's health and particularly in pregnancy continues to be done because we have so many unanswered questions about how emotion, how life experience affects the growing fetus. We do have data on something called adverse childhood experiences or ACEs, so things that actually happen to children after they're born and how that affects their school performance, their emotional regulation, their propensity for things like substance exposure and subsequent abuse when they get older. However, we don't have that great data for pregnancy, right? So I encourage anyone who's listening, if you've never heard of ACEs, to look at adverse childhood experiences and how that can shape a brain. And just know, too, that there also work on positive childhood experiences and how those can be a buffer for adverse childhood experiences and how that can also help shape resilience and other things that can help you overcome adversity. So there is hope there, too. I also wanted to say, in giving that sort of long scientific answer, that I'm so sorry to hear about your brother. That is a terrible trauma for you to have to go through.
Yes, largely why I'm in the field that I'm in, but very challenging to see that. It was hard, and I imagine quite hard on my little brother too, but I appreciate that. As far as this book that you wrote, all these things that you are learning about in your field, what are you the most passionate about and why, as you're writing this book? One message you want to get out there?
I want parents to know that they are enough, that what a baby really needs to grow their brain and shape their responses to the world is a loving, attentive caregiver. And that doesn't mean a caregiver who knows everything and has all the right answers. It means a caregiver who is open to learning things that will help their baby grow and thrive and who is going to be actively responding to baby because it's the act of trying to make that connection that can make that connection grow and blossom.
I have to say something to that attentive part. How attentive are parents that you see? Is it pretty attentive, or are you finding other distractions are really impairing that ability to bond, like tech?
Yeah, there was an interesting study looking at how much time birth parents spend on their phone after delivering a baby. I think we are in a world of distraction now. So much is right at our fingertips with our smartphones and our social media. And that can be distracting and take time away from focusing on that human connection, not even just with baby, but with other people in your life. And you want to have other safe, stable, nurturing relationships to be able to support baby in their growth too. Because remember earlier on, we said it's a community effort, right? And as much as I think we need a lot more research in this area too, we need societal supports that are going to allow parents to spend more time with their infants and with their families to be able to grow together as a family and also learn about the people they're bringing into the world. So I don't want to put all the onus on the parent. I think we have a lot more we can do as a society to really support bonding and connection between parents and their newborns.
Yeah, absolutely. And I think it's just all relatively new. I'm sure there's a lot of research that I'm not aware of, but how much time we are giving up, sacrificing to these devices that we don't even recognize. Like it's so mindless. I know a lot of times when I was nursing, just scrolling, doing whatever, but it's not anywhere near where it is now.
These devices, like their whole function is to engage you, right? Like there are algorithms on social media that target you to give you content that you're going to relate to so that you stay engaged with that content because they're learning about you as you're using these platforms and online. And so I think you bring up a good point that we all have to just be really mindful of the amount of time we're spending on these things because it is taking away and it wants to take away from human interaction and from engagement and community. And those things are so important.
Yeah. So, Joanna, I have to ask if you were to do it all over again, knowing what you now know in the field, how would you do it differently with your own babies? Or maybe you did it exactly how you wanted. I don't know.
I'm only laughing because I really think of parenting as an iterative process. And what I have learned as an infant expert is there is still so much more for me to learn. There is just endless learning you could do about topics that you get really interested in. And so I think people should always keep an open mind and be open to learning through experience. And so things that I did for my first child, I definitely did differently for my third child. One thing I usually highlight is I remember I spent so much time on my baby registry for my first baby because I had this conception that if I had all this stuff, that this was going to prepare me for parenting in some way. And then I realized for my third that there's not really that much stuff you need with a newborn. And with my third, I really did spend a lot more time focusing on my relationship with them and on envisioning the person that they wanted to be. And so I actually did a vision board with kind of my hopes and desires for the future with that baby. And it was really just a great exercise for me. It allowed me to involve my other kids in it a little bit as well as they envisioned what it was going to be like to have a new sibling because my other kids, when my youngest was born, were 6 and 4. So they were able to start to think about these things. If you have younger kids, they can't. But it became a great way for us to all think about welcoming a new person into our home and help me also get through that newborn period, which can be challenging because it's so demanding to parent a newborn, because it helped me to think about the future and set my expectations a little bit differently for how I wanted to parent.
I love that. I never thought of doing a vision board with your kids about that coming baby. Like I've done it with a child for their life, but that is such a beautiful, simple thing that you can do to prepare for it and get used to it. Joanna, I just have one more question for you today. And I like to end with asking guests how they have deepened fulfillment, whether it's in your area of expertise or what you would recommend for others that are in this space. They're about to have a newborn, they have a newborn, or they're helping somebody through it, like how they can deepen their fulfillment and live a life without regret. Do you have any thoughts on that?
I have so many thoughts on that. So I'm going to try to give you something that I do in my day that I find really fulfilling. You mentioned I'm a mom, I'm a baby doctor, I'm a podcaster, I wrote a book. I'm a woman who's very dedicated to my career, and it's how I'm hopeful that I'll make an impact in the world and help others, moms and babies. As much as I am passionate about my career, I consider my relationship with my family to be my North Star. And it's having that family and that community that gives me the resilience and emotional release that I need to be able to do sometimes difficult work at work, right? And so every day when is possible, because sometimes I do work nights and I also work weekends. So every day when it's possible between the hours of 5 and 7, I put my phone away and I don't have it with me and I focus on my kids. And they might not like that. They're 7, 5, and 1 now. So they really enjoy it. They might not like that when they're teenagers, but it is a practice that I want to continue to do because having that focus time with family is something that really fulfills me and keeps me going in my other work that is also important to me.
Oh, that's so beautiful. I try to do something similar, not quite as structured, but like we sit down to dinner. Call it like my sacred ground. But I think that's so beautiful. The 5 to 7 thing, just really setting that precedent. This is our family time. This is what we value, what we want to focus on, and where really true joy comes. But I think that's a great to give and to leave us with. So thank you very much for sharing that. And Joanna, where can we find you?
You can find me every week on Pediatrics on Call. It's the American Academy of Pediatrics podcast. So definitely listen for me there. I'm on Instagram at Joe Parga-Belinkie, MD. So you can find me there and occasionally see my kids and things I post about babies and work and children's health in general. And if you're interested in my book, you can find it on really anywhere where you buy books, but it's published with the American Academy of Pediatrics, and they have a publishing site, so you can definitely look there for it as well.
Wonderful. And I'll put that in the show notes as well so we can find you there too. So thank you again for coming on, Joanna.
Thank you so much for listening. As always, please head over to our website, fulfillmenttherapy.org, to see our new courses. We have, in the past couple months, added Podcast Profit Mastermind, and we are so excited to share it with you. It's our third part in our podcast series, and we would love to see you there. As well as, please go ahead and leave us a review on Apple Podcasts so that way we can get found. And if you have any questions or comments and concerns, we would love to hear from you. Have a wonderful week, and we'll see you back here every Monday and Thursday.